Hi, everyone. So I wanted to do a quick case presentation today. This case is based on our NIPT test, which we are all using so often today, and is primarily directed at obstetricians. So this is Mrs. X, gravida 3, para 2, living 1, and an RH negative pregnancy. Her first pregnancy is a 10 years old male child showing mild to moderate developmental delay and learning disabilities at this time. It was a preterm cesarean section done in view of abruption with IUGR, and the baby developed HIE. It was 1.4 kgs at birth, and that is why the developmental delay. The second pregnancy was a difficult conception, and it ended up being an IUD at 7 months, followed by a vaginal delivery, but no further details of the pregnancy were available because the parents had discarded the documents from this pregnancy. The present pregnancy, the patient had conceived after treatment. Her ANC antenatal care was not with us. It was with somewhere else where the NT scan was done. There were suboptimal images and reporting on a detailed study of the report. The scope of this talk is not about what is an ideal or what is an optimal NT scan. We can discuss that at a later date. The risks were not calculated, though the NT and NB were reported and was reported as normal. A double marker test was also done, and the patient was reported to be first trimester combined screen negative for the common Down syndrome and trisomy 1813. This is a double marker test. We will be coming back to the double marker test. As you can see, the age alone risk was 1 in 730, but the Down syndrome risk was 1 in 1120, and the trisomy 1813 was 1000. The NT-NB was reported as normal. The PAPAPE was 0.17 moms, which some would consider as, most of us would consider as abnormally low, and an HCG of 0.85. So both on the lower side. Now, this was her first trimester screening report, after which the patient was reassured and called for a level 2 scan, which was done at 18 weeks. This was also reported as normal, but she was advised an NIPT at this point. Why was she advised an NIPT after a supposedly low-risk first trimester screening? The cause is not known at this point. The patient was on iron, calcium, and ecosprin. She had no other high-risk factors. So now the NIPT report. Now, this is the NIPT report that she received after 2 weeks, where she was told that there is high risk for abnormality in the chromosome 18 and high risk for abnormality in chromosome 9. And there was a deletion of chromosome 18 of approximately 14 MB and duplication of chromosome 9 approximately 39 MB. So now this is a very highly specific kind of a report to be given on NIPT, and it seems highly suspect if it comes to someone who is trained, because uh, these findings would correlate with findings on an ultrasound. You wouldn't have a normal ultrasound with abnormal chromosome 9 and chromosome 18. It would be highly unlikely. Second, seeing the double marker report and an abnormally low PAPA, we would suspect that there is a high chance of confined placental mosaicism in this case, or any placental abnormality. So now the patient had come in this, the fetal fraction reported was around 8%. So that was normal. So now the couple came to us for termination. At this point, she was already 20 weeks, 5 days. And she came to us and she said, we want a termination because we've been told that we have an NIPT report, which is abnormal, and the baby will not turn out fine. So she came to us and I explained to the patient that an abnormal NIPT report, that the findings on the NIPT report do not correlate with the scan. We, of course, repeated the scan. The scan was normal except for an echogenic intracardiac focus. And secondly, that we did suspect some placental mosaicism on a false positive NIPT. There was a chance for a false positive NIPT, second. And third, that we could not possibly offer termination on the basis of an abnormal NIPT. We would always confirm, no matter what the report, we would always confirm it with an invasive test, and only then. This couple of course, was keen on continuing. And so it was hard to convince them to do more expensive tests, like it always is if they've already had an NIPT, but they were keen on continuing. So they agreed to further testing. And reports, this is the karyotype report, which turned out to be normal, and a chromosomal microarray as well. Again, the scope of why we ordered the test that we did is beyond this talk, but the CMA also turned out to be normal. At this point, the baby is almost term and growing normally. So now I really want to stress that false positive NIPT is a reality. A pregnancy cannot and should not be terminated on the basis of an abnormal NIPT report without confirmation by an invasive test. A double marker test report needs to be interpreted. It is not just about low risk or high risk or screen negative or screen positive. There is a lot of information that you get from all these tests, which should be gleaned for the benefit of the patient. And the most important take-home point, which I have not included here, do not offer unindicated NIPT tests. We are seeing NIPT done for each and every abnormality, whether in the history, whether in the level 2 report. This is hardly the first report that we are getting with false positive, but normally we would see a sex chromosome linked abnormality, which is more obviously false positive. Then we see chromosome 9 or chromosome 15 related abnormality. This was a very highly specific kind of a thing. And the lab, I will not comment on the labs or the scans here, but it was a new lab, which I was unfamiliar with. So we also need to be careful about our choice of labs, our choice of tests, our choice of patients and indications when we are offering something like an NIPT test. In this case, no doubt the person wanted to help the patient, give them more answers, solve all doubts, but we've just led to more and more problems in this case. And I will not even go into the kind of care that an RH negative pregnancy should get at this point and has not received, and the other kind of things that could have been done for her bad obstetric history. Those are beyond the scope of this discussion. This is basically to point out that false positive NIPTs are coming to us all the time, and NIPT cannot be the basis for termination. And please be careful before ordering these tests. Thank you.